I'm Charlie Luong, I'm one of the internal medicine doctors. I'm a hospitalist here at St. Luke's University Health Network. I chose internal medicine because it covers an array of ages. We take care of patients anywhere from the 20s into the late 90s, from beginning adulthood to the end. We do coordinate with multiple specialties, and that completes the entire workup of the patient. I went through 4 years of undergrad at Temple, initially starting as biochem. Working in a lab just, wasn't my cup of tea. I'm more of a people person. Interacting with patient and families brings joy to me. So when you take care of a patient, there's multiple organs that are involved. And the physicians here in the network work together, and it's a very friendly environment. It helps coordinate the care of the patient, and ultimately the outcome is successful. The hospitalist role is a fairly new field. Usually the family physician as an outpatient has a good rapport with the patient. When a patient comes into the hospital, you have to build a connection with them. So even though we only take care of the patient for several days at a time, we have a strong connection because they're in the hospital at the time of their need. We do coordinate the care with the primary care physician as an outpatient, but also with the specialist in the inpatient setting. What I do best here in the network is mainly communication. So I try my best to discuss the case, and ultimately I make recommendations to not only the family, but the patient, and they ultimately have the choice in what they would like done for their care. My promise and commitment to the patient is ultimately I want them to be satisfied. Have we answered all their questions during the hospitalization? Have we attended to all their needs? Are family happy with the current workup? And ultimately, have we solved the main problem why they came into the hospital? As a native of Allentown, I always wanted to stay back in the area. My parents and family are in the area. I had several hospital systems to choose from. Ultimately, I found that St. Luke's University Health Network is a large teaching institution, but also offers big city medicine, but at a hometown care. Everyone's very friendly, and ultimately, patients are happy here.